Hello all, I am Dhanashree welcomes you all to this episode of Shree Ramkrishna Netralaya. As they say, where words are restricted, the eyes often talk great deal. This is the beauty of the eyes. And to maintain this beauty, one should take utmost care of their eyes. Here, Shree Ramkrishna Netralaya helps us. This episode is particularly Patient Awareness Initiative by Shree Ramkrishna Netralaya, where they offer efficient and affordable solution to your every eye problem. Today our topic is computer vision syndrome, and to guide on this, today we have with us Dr. Vishakha Parate, who has done MBBS, DNB in ophthalmology. She is a cataract surgeon and associated with Shree Ramkrishna Netralaya. Hello Dr. Vishakha, welcome to this episode.
Thank you so much.
First of all, many a times and in nowadays, in modern days, work from home culture or trend has brought development in many health problems, especially in your eyes, like redness in eye or dryness in eye. So we are going to talk about computer vision syndrome. What is computer vision syndrome exactly?
So in today's world, as we say that we have a work from home culture, so usage of screen, mobile phone, computers, everything has increased to more than at least 2 hours a day. So the symptoms arising from usage of more and more of screen time and sitting at a place has led to a lot of ocular symptoms that we face, including redness, blurring of vision at the end of the day, eye strain, headaches, neck pains, and dry eyes. These are all symptoms that we collaborate with ocular conditions, and that we term itself as a computer vision syndrome.
So how a patient get diagnosed with computer vision syndrome?
So most of the times these syndrome, that is computer vision syndrome, goes unnoticed by many of the patients, but a lot of patients come to us with symptoms of redness, blurring of vision at the end of the day, headaches. These are the most common symptoms that are being presented to us, but majority of patients go asymptomatic, and they do need evaluations for to treat computer vision syndrome.
Redness in eyes or dryness in eyes can be some temporary problems also, not
Correct.
permanent.
Correct.
So how do you get to know about computer vision syndrome if a patient has it?
So when the patient walks into us with these symptoms, we have different technologies and techniques that are available at our hospital to help us diagnose these symptoms and to diagnose computer vision syndrome. We have and also for the patients and the relatives who are coming with them, those patients who go asymptomatic for computer vision syndrome, we have a lot of questionnaires available which is given to every person who enters our hospital, and from these questionnaires we detect whether the patient is actually, whether the person is actually complaining or has computer vision syndrome or not. Also, we have different technologies available with us which will help us detect the dryness that is associated with computer vision syndrome.
Dr. Vishakha, as you mentioned, redness or dryness of the eyes and how to treat them, how to diagnose them. So, is the dry eye related to computer vision syndrome?
Yes, of course, it is one of the major symptoms that is associated with computer vision syndrome. Most of the times dryness goes unnoticed, though patients do have certain complaints related to dryness, but they do not know it, and they do not come to the hospitals to get it treated, and at the end of the day it gets aggravated to a very larger form. So we have various tests available at our hospitals which can detect the dry eye.
As you mentioned, dry eye is related to computer vision syndrome, or it is a part of the computer vision syndrome. What happens exactly when computer vision syndrome occurs in layman's language?
So the symptoms that I have explained you, redness, excessive watering, photophobia, that is sensitivity to light, dryness, double vision, these are all symptoms of computer vision syndrome, including dry eye. But why do these symptoms occur is because you are using more and more computer for your workplace, or because of advanced technology. So with the usage of computer, as we know that the letters in the computers are pixelated and they have less clarity, so the eye tries to focus on these letters more than what we can do in at our normal workplace. Also, there are a lot of glare that happen when we are using computers or screen, especially from the lights that are overhead above us, above the computer screens, or the window lights which get reflected. They cause a lot of glare to our eyes, which causes defective vision, or we can say they decrease the focus in our eyes. Also, the more we try to look at the screen, the lesser we blink, and blinking is one of the most important factors in maintaining the eye health. So the blink rate reduces drastically to up to 4 to 5 blinks per minute, when normally up to 10 to 15 blinks per minute are required for maintaining the vision. Also, with usage of computer, the computer screen is quite close to our eyes, and there occurs convergence fatigue that happens, and these all symptoms cumulatively, if computers are being used for more than 8 to 10 hours a day, they cumulatively will cause computer vision syndrome, and then slowly, not in a day's time, but slowly and steadily will develop into symptoms of dryness, redness, headaches, increased cause of refractive errors.
Okay. So what is the treatment for this?
So basically, treatment is at first is at the personal level. So you maintain the screen at a distance of 16 to 20 inches in front of you. The screen is to be placed besides a window so that the light is not above you, or the light does not fall on the screen. You maintain the screen at a level which is at least 20 degrees lesser than your eye level. You do not sit in front of the air conditioner. The air conditioner in front of you, or the air dryer that is in front of you, will cause dryness in your eyes. So one of the major factors. So you do not sit in front of the dryers. Also, try to blink frequently. Take more frequent breaks from your work in order to reduce the fatigue to your eyes. For this, you can apply a simple 20-20-20 rule. For that, you take a break after every 20 minutes from the screen time for 20 seconds by looking at an object which is 20 feet apart. So in general, you can say that after every 20 minutes, you look at an object which is outside the window, which is much bigger, for just 20 seconds, and resume your activity. These are the basic things that are need to be done at a personal level in order to reduce the symptoms of computer vision syndrome. We also have a lot of facilities available at our hospitals which will help us in diagnosing the symptoms at an early stage, especially the symptoms of dry eye. So we have a serious technology that is available with us that will detect the tear film breakup time. Normally the tear film breakup time is about 10 seconds, or should be more than 10 seconds, and it reduces in cases of computer vision syndrome to less than 6 seconds. So it is a very easy and a quick test that is available with us, which will detect dry eye. We also have Lippy View test. This Lippy View test will detect the meibomian gland functions in our eyes, which is important for the lipid layer formation in our eyes. So this test will detect any sort of abnormalities or dysfunctions in the meibomian gland function, which is important for prevention of dry eye. And another test which is there is the inflamma dry test. This inflamma dry test is for those with inflammatory type of dry eyes. This is the end stage of dry eyes, and it will detect the dryness of the maximum level, and which can be then later on treated with medical management.
At Shree Ramkrishna Netralaya, how doctors treat the dry eye problem?
So we have modern technologies that are available for the treatment of dry eye. One of the most prominent technology available at our center is the Lippy Flow technology. This technology actually is for any dysfunction in the meibomian gland. So the dysfunction that is measured with the Lippy View is then treated with the Lippy Flow treatment that is available with us. We also treat dry eye, and the major component in treatment of dry eye is the lubricant. copious use of lubricant, frequent use of lubricant is very important, and regular follow-ups with the patients along with personal care is very important in treatment and management of dry eyes.
Thank you, Dr. Vishakha, for giving detailed information about computer vision syndrome. Thank you
Thank
so
you.
much. If you are facing any such kind of syndrome or any eye problem, Shree Ramkrishna Netralaya and their expert doctors are always ready to help you. Shree Ramkrishna Netralaya is located in Thane, Navi Mumbai and Mulund.